So we try not to engage the patient directly with the prescriber. So the least in this case, what we can do, and basically the most we can do, is we receive a prescription, we explain the beneficiary that there are more requirements which are needed, because we may need discharge notes, we may need treatment plans, clinical progress notes, because that's what the payer wants to see. But we take the responsibility of acquiring all of those documents. The timing is not really in our control. That one thing which becomes a little bothersome, even for me also. I don't enjoy this part, but it's not in my control, where two parties are involved and the physician and prescribers are very busy, seeing their patients, taking care of them. So both of our professional sides are busy. And in this case, the patient, they have to wait up until the documentation is not complete. Okay, so I can move to the sizing now on the canes. So why sizing and a fit is very important. As I said, I chose canes as the first slide when it comes to sizing. The posture of the body, and like Steve touched this topic in the beginning, a proper fit is extremely important, because an improper fit is not only useless, but it can be very harmful, because the body basically adjusts itself according to the situation and surrounding. I have seen many cases, we see these cases all day long, where someone is using a cane and they are there and they are talking about a different complaint. I don't have clinical training in orthopedics, or I'm not a therapist or a physicist, but I can still tell that by looking at their posture and the equipment they are using is not fitting well. That one thing I can confidently say. So even for something which looks as harmful as cane, you can see this picture here, there are a few rules which we commonly use. And in these rules, we basically look at the arm angle. Again, this is eyeballing method. We don't have very sophisticated technology, but we are still looking at it, that is not overextended or underextended. The height of the canes, which are commonly adjustable, which we usually always pick up an adjustable cane, because that's important. And then the way the beneficiary or the user is holding the grip. Because if you notice in these three pictures, and these are just three pictures, there are so many different canes. The grip and the handle is different. And it's not really designed, like one grip is not designed for the whole population. So we have our patients usually try a couple grips made by a few manufacturers. Sometimes the feel of the rubber also gives different people different kind of confidence. And I observe all of this, if I'm there and whenever I'm handling with a patient. So that's something which is a very important topic, which is the proper fit and the usage of equipment. Exactly, yeah. And then again, so the choices which